My name is Simon Kiganga, a 35 years old guy. I live in Tanzania, in Mwanza region, the place where I was born. I started feeling pain back in August last year, 2013. I went to the hospital in Mwanza, but they couldn't understand exactly what I was sick from. And then I was referred to referral hospital in Dar es Salaam. There I went through a MRI testing. It was realized that I'm sick from disc prolapse or disc sleep. But actually it wasn't disc sleep. I was diagnosed there for almost 2 months, but I couldn't feel better. I wasn't improving anymore. I arrived in the India airport, Bengaluru. Then I headed straight to Manipur Hospital. The first day everything went good, all the tests were finished. I really appreciate the good staff of Manipur, that they took care of everything. Then I was referred for surgery. My surgery went quite well. I felt some pains. It's normal after surgery. But in 3, 4, 5 days, everything started going good.
Simon Kiganga has been a 40-year-old male presenting with history of back pain for the last 4 months. Came to us in December with such severe pain that he couldn't change position on bed, he couldn't get up from sitting, stand, and lying down, and he was really literally in pain for the last 4 months. He had an MRI which he brought along with him, which did show a lytic lesion in L1 vertebra, but put down by his doctor saying that was okay, but it was only the L4-5, which was a mild disc prolapse, which they thought would be the cause of his pain. We did repeat a contrast MRI which clearly delineated a lesion in the L1 with the soft tissue epidural component, which clearly depicted that it was a tumor more than a normal narrow signal intensity change, and hence he was advised a open surgery to take a biopsy from the lesion and to decompress the spinal cord, as well as ending in spinal fusion. This was in contrast to the treatment plan that he had been offered based on his email correspondences with the MRI report from Tanzania. We had in fact planned for a vertebroplasty or a kyphoplasty surgery, thinking that L1 is just a pathological lesion without soft tissue component into the spinal canal. But having a soft tissue mass in the spinal canal makes it necessary to open up the spinal canal and also fix the bones above and below. Although the X-ray that we did here showed no major abnormality, but the MRI was very clear. You can see this, the soft tissue mass behind the vertebra of L1, which was pressing on the spinal cord. And then he underwent a surgery, which we talked to. We fixed 2 bones above, 2 bones below with screws and connected them with the rods on both the sides, and the patient was up and about, walking on his feet on the very same day, maybe 4 hours after surgery, and he was discharged on the next day of surgery, awaiting biopsy report. The histopathology turned out to be a surprise, with evidence to show that there was a lymphoma, and he was referred to the oncologist who started him on chemotherapy.
Having finished the surgery, Dr. Vidya told me I need to wait for my biopsy report that will tell me exactly what I was sick from. At that time, I had already known the difference between what was diagnosed in Tanzania and what was diagnosed in here. Because in Tanzania, they told me the disc prolapse, while it wasn't a disc prolapse. So I waited for the biopsy report. When the biopsy report came after 5 days, it was realized that I have lymphoma cancer. Then I was sent straight to the comprehensive cancer center, where I met Dr. Amiti Lawton. Amiti Lawton is a very friendly doctor. Having got the information that I'm sick from cancer, it's a really shocking moment. But he gave me hope. He told me my cancer is curable. It's 80% cured. So I was almost to be in despair, but having spoken to doctor, I saw my life is there again. I started straight under the supervision of Amit Rotten, and everything is going good. I have run 2 cycles to date, so things are moving good. If I would explain about how did I start feeling having finished up the surgery, in the first 3-4 days it was really painful. But then later I started walking by my own, standing on my own feet, everything started going good. And I really appreciate the generosity of the staff member of the hospital at Manpos. And I recommend so many people to be here. I have many different people from different walk of life, but people in India here, especially at the hospital, they're very friendly. If I were to explain about Gita, she has been a great and a wonderful woman that she has been helping us a lot. She gave phone calls to us every day. What's going on, Simon? Where are you? I'm in hotel. How is going on? So everything has been really smooth. I really appreciate you guys.